Yes, so the main question we wanted to look at was, do people with genetic risk factors for dementia, so people with genetic susceptibility for dementia, do they benefit from lifestyle interventions? And we used a multi-domain approach here. So multi-domain approach means, on one hand, lifestyle intervention that targets multiple risk factors at the same time. And on the other hand, we wanted to look at multiple genetic risk factors. So of course, APOE epsilon 4 allele, which is very important for Alzheimer's disease, for example, but also polygenic risk scores. Well, it's all good news, I think. I think we can be pretty sure at this point that it's good news. So what we are seeing in our results is that people with higher genetic risk, either because they are APOE epsilon 4 carriers or because they have a higher polygenic risk score, they benefit, so worst case scenario, they benefit at least as much as the people with lower genetic risk, but it's actually looking like they may be benefiting more than people with lower genetic risk. This is the finger trial only results at this point. A single trial is not really, doesn't have the statistical power to confirm this kind of findings. So we're seeing some signals in this direction, and what we plan to do in the Worldwide Fingers Network, so that's a global network of multi-domain lifestyle dementia prevention trials, to do joint analysis across multiple trials when their results become ready, because many of them are ongoing at this point. So do joint analysis and see if we can confirm this across multiple populations, genetically diverse populations, because fingers done in Finland, it's a pretty homogeneous group. We want to see this outside Finland, also outside Europe as well, across. Yes, of course, we are trying to use these results in the new finger-based trials, and MedFinger is special because it's the first Finger 2.0 trial. So it's a model that combines the finger lifestyle intervention with potential disease-modifying drug. In this case, it's repurposed, so Met is from Metformin, the diabetes medication. And what we are doing is we are targeting a population enriched with APOE epsilon 4 carriers, because we've seen in finger and also in other trials like MAPT in France and also JMINT in Japan, that APOE4 carriers do have more benefit than non-carriers. So we are including them.